And joining us now is Dr. Brian Clark, Chief of Pediatric Cardiac Surgery at Pensay Health Children's Hospital. Thanks for being with us.
Thank you for having me.
What a remarkable story. Tell us about cardiac surgery at Pensay Health Children's Hospital.
Well, the pediatric heart team at our children's hospital cares for all forms of congenital heart disease, which is heart disease that is present in babies at birth, a heart defect present at birth. Approximately 1 in 100 children born has a heart defect.
Wow.
Some of these heart defects are not so severe that they require early surgery, and surgical repair can be delayed until later in infancy or into early childhood. On the other hand, some are more severe and require repair in the early newborn period. Approximately half of the children that we take care of with heart surgery are under 1 year of age. So caring for babies with heart disease is an important part of our practice.
Yeah, absolutely. Now, you were recognized by U.S. News and World Report as one of the best programs in the nation. What makes your program so special?
Well, in recent years, the methodology that the U.S. News has used to rank pediatric heart and cardiology programs has increasingly relied upon patient outcomes, which means how well patients do following heart surgery. And those outcomes are things that can be measured, like hospital survival and avoidance of complications. Our program has consistently, for many years, offered outstanding outcomes to patients and families. And our hospital survival has been well above the national average for quite a long time.
Yeah, and certainly Caden is a perfect example of that. Now, you work very closely with pediatric cardiology and labor and delivery to coordinate deliveries when you know there may be a problem with the baby's heart. How do you all work together?
That's correct. It's a complex situation involving a lot of providers, but usually heart defects in babies can be found on routine ultrasound. When a heart defect is found, perhaps by an obstetrician, the mother is usually referred to a pediatric cardiologist with special expertise in imaging who does a dedicated ultrasound of the baby's heart. Depending on what the heart disease is, it may be recommended that the mother delivers the baby at a children's hospital that can offer pediatric heart surgery. In that case, we would offer the mother consultations with all of the specialist providers that would be caring for the baby after birth, such as cardiologists, neonatologists, and surgeons.
And we have heard you say that you do an amazing job working with parents, breaking down all of this information and really putting them at ease. How do you take care of the families during this very difficult time?
Well, I really consider that one of the most important aspects of my job, and it's one of the things that I find the most pleasurable. I enjoy meeting with them at this time, which often feels like a crisis, and trying to take a complex and potentially overwhelming situation and make it as simple, understandable, and manageable as possible. I like to take as much time as they need, and I really feel like the most important part of that conversation is letting them know just how much their family means to us and how much the care of their child means to us.
Well, you certainly put them at ease. Dr. Clark, thank you.
Thank you.
And if you would like more information or if you would like to schedule an appointment about Pensay Health Children's Hospital, visit online at pensayhealth.org/children's. Let's check in with Denise.